Welcome to Clinical Learning Reimagined, the podcast for health professions educators who believe that improving clinical learning from the beginning is a passion worth reimagining. I'm your host, Dr. Leslie Fall, founder and CEO of Aquifer. Each episode, I sit down with a boots-on-the-ground clinician or basic science educator and thought leader, visionary innovator, or leading researcher who saw an emerging problem or need and courageously started to address it, asking hard questions, testing long-held assumptions, and pursuing bold new ideas and building towards something better for all of us during the most disruptive times our field has ever seen. These are real conversations with people working at the forefront, the ones I believe are best positioned to help us envision the way forward and build on their work. So, pull up a chair and let's reimagine together. Today, I'm joined by my colleague, Dr. Omer Awan, Professor of Radiology and Vice Chair of Education at the University of Maryland School of Medicine, with a special interest in both education and informatics. Omer has been at the forefront of using technology to transform how we teach and practice in ways that are both informed and impactful. While I've known Omer for years, what caught my attention recently is his willingness to talk openly and in a really real fashion about the impact of AI on the experience of clinicians, patients, and learners as we all move into this brave new world of healthcare. Omer, welcome to Clinical Learning Reimagined.
Thanks so much for having me, Leslie. I'm excited to be here.
That's great. At the outset, I'd just love to hear more about your own journey into medicine and into education and whether there were any real crucible moments for you.
Yeah, so honestly, for me, no real crucible moments, to be honest with you. I've always wanted to be a physician. I come from a family of physicians. My father is a pulmonologist. I have three brothers. Two of them are physicians as well, one internal medicine, one interventional radiology. And even education wasn't even something that was on my radar initially. I think what happened was when I did my fellowship at the Beth Israel Deaconess Hospital in Boston in MSK radiology, I, like yourself, Leslie, did an education fellowship. It was just something that I wanted to do because I was like, hey, maybe I'll just try it. It's the opportunity is available for me. Let's just see what this is all about. And I was blown away when I did that. I think it just opened my eyes to, what was possible, a way to really inspire the next generation of learners. And that's really what sort of piqued my interest in, hey, education is really the path that you should be going on. This is an opportunity for you to inspire young minds, give back in a very meaningful way, and really put a lot of purpose into your profession. And I think that's what attracts so many of us, into education and to doing the work that we do. I know it's part of, your mission at Aquifer and your why, your overall why to why you do things.
Frankly.
So, that's really why I wanted to be an educator.
Well, that's great. And, I think that's a lot of the reason why you and I connected. But, also, as we were talking about before, you're a regular medical contributor to your local news stations. You've got your own YouTube channel. You're writing for Forbes. So in addition to medicine and education, kind of when did you realize you were a physician educator, yet with an innovation and thought leader DNA built in there as well?
Yeah, it's interesting. I've never thought of myself like that. I've never thought of myself as a thought leader or, that type of DNA. I just kind of evolved as time went on. Really that's really how it happened. I take a lot of joy in just teaching and making a difference in, the medical students that I interact with, the residents that I'm interacting with constantly. I just want to be able to give them and help them in a way so that they can do good for others. Just like almost any other physician, but I, like yourself, have just kind of taken the opportunities that have been given to me, and that's really the way it's worked out. I started to write some op-eds, during COVID in some of my local newspapers like the Baltimore Sun. And then, that got picked up by a lot of editors. Some of the Forbes editors reached out to me and said, hey, do you want to start writing for us? And I was like, sure, yeah, I would love to write for you guys. It was just a pleasant surprise. And then one thing leads to the next. You start to write for Forbes, and then certain media outlets start to ask you to start talking about public health matters, and I just say yes. Just like we're all sort of trained to do in medicine, we say yes to opportunities that are given to us, and it just one thing sort of leads to the next, and it's sort of a domino effect. So definitely didn't have any aspirations to do this. It wasn't like I want to be a media contributor, I want to write Forbes, or I want to have a YouTube page. I mean, even the YouTube page it was recommended to me by one of my residents. Actually, one of my residents at University of Maryland said, "Hey, Dr. Awan, maybe you should consider doing a YouTube page. I think people would benefit from your teaching." And I was like, "Okay, yeah. I mean, I've never done this before, but sure,
What
let's
the
try."
heck?
This was
Let's do it.
exactly. I mean, this was 2019 when I started. So I've also just kind of evolved and kind of gone with the punches and just see where one event takes me to the next, and certainly not planned.
Well, it's certainly probably going to lead into a lot of our conversations today because you've leaned into AI in clinical care and AI in learning. So, what are you working on right now that's just really exciting you?
So what's really exciting to me is, digital education. I think that's been something that, I know Aquifer has focused on a lot too, digital innovative education. How can we reach a multitude of learners in ways that resonate with them? Because now, the younger generation, millennials, Generation Z, they're learning very differently than the way me and you learned. And I
Right.
think that they're looking at platforms, they're looking at social media, they're looking at their phones, their tablets, and they're learning in a very unique way. And it's up to us as educators and as leaders in the field to appeal to them, appeal to this next generation, and to show them and give them a way where they feel like they're part of the process as well. They feel like they're having fun while they're learning. And,
Yeah.
digital education is a huge space that hasn't been tapped into enough. That's a project that I've been working on. And for me, it's kind of translated into media. How do I write in a way that can reach a global audience? How can I come on to different national news outlets, News Nation, CNN, whatever it may be, MS Now, and speak about public health in a way that it resonates with people and in a way where they can understand complex information in a very simplistic way where they can go and do actionable things. That is sort of the focus of what I've been trying to do in the last couple years because, health information, whether it's AI, whether it's, how to stay healthy during heat, it's important, right? And people want to know how to do it. So it's up to us to provide, credible information so that people can benefit.
Yeah, well, that's great. Well, let's tap into that because I have a couple of questions for you just based on, the work that you've been doing recently as well. So in May, you wrote a really nice article for Forbes, and I just want to quote a few pieces of that and then just leverage that a little bit into really some of your thoughts about its use in clinical learning right now. So you wrote that the most advanced as AI becomes, the greater the need for physicians capable of overseeing it responsibly. Ultimately, patients want to be heard, to feel seen, and it's that rapport at the center of the patient doctor relationship that will allow this to occur, not machines or chatbots. An emergency physician similarly balances competing diagnoses, social dynamics, limited information, patient preferences, and rapidly evolving situations in real time. AI can assist with these decisions, but cannot fully replicate the human judgment developed through years of clinical training and bedside expertise. So I'd love to just talk more about that in the context of what you just read about, what I just read that you wrote. Walk us through how you're using AI in your clinical teaching right now.
Well, we use AI significantly. And, I think my career as a radiologist, I'm a musculoskeletal radiologist. And, radiology is really at the forefront of AI because it's so technologically centric, right? And, more than most other fields in medicine, so AI really came to radiology, I would say, before it's come to permeated any other fields in medicine. And I think we use it a lot. So for example, just in terms of diagnosis, we use AI software to help us diagnose certain things like breast cancer on a mammogram or a head bleed on a CT scan or a pneumothorax on a chest x-ray. These cases get flagged by our AI software that, hey, there's a finding, take a look at it. But it also helps us in a lot of other meaningful and practical ways. And one is, in terms of increasing our efficiency as radiologists. And one example that I'll give you is that when we dictate studies, we use a voice recognition software,
Right.
where, when we speak into a microphone and then it transcribes what we're saying as we're speaking. And, everyone who's in medicine and medical schools know that, the way a radiology report works is, the indication, a technique, you have the findings of the report, and then you have an impression. And really what patients and what other doctors care about is the impression. It's sort of the summary at the end of a report that tells you exactly what you need to know.
Hmm.
And what we have now is that we have an AI system that will automatically populate your impression based on your own language. So what it does is it mines your own reports, thousands of reports that you've dictated in the past, and will use your own language to craft an impression
Wow.
kind of exactly how you would do it. And it's amazing. I literally don't even have to change the impression 90 to 95% of the time, because it has learned the way I speak. It has learned the nuances and the way I want to convey medical information. And it does it at an amazingly accurate level. And imagine what this is doing. So if I'm reading 50 cases a day and I'm dictating findings, and I don't have to spend a minute per case crafting an impression, I've saved 50 minutes in my day just by using that tool. And
Right.
that's exactly what's happened. So I think in a lot of ways, it has really reduced our physician burnout. It's increased our efficiency as radiologists and as clinicians. And it allows us to do other things that we like, joyous things like teaching, for example, or, taking care of patients, things that are meaningful to us. And I think in this way, it will really allow us to beat burnout, beat bureaucratic tasks that we don't want to do. And this is just one example. And I think this is like a very powerful example of how AI is really flourished and how it's really being used right now currently in radiology.
Let me dig into that a little bit more, though. So I have these very clear memories, of being here as a medical student. And I was, sitting in the radiology reading room, with my attending, looking at films and being quizzed on films and talked through films. And he or she had a dictaphone, in front of them, and they were dictating the film as we were reading it together. And one of the things I recognized is I was listening to them over and over and over. And even though it was sort of passive, ambient learning, I was picking up how to think like a radiologist, how to speak like a radiologist, what they were looking at, what they were talking about. Now the challenge with AI is, the students will be coming into a system in which that's not in front of them anymore. You're doing it, in your AI system, but they're not seeing you do that as a radiologist, as a faculty member. So how is that really, changing? Are you using that time for a different kind of teaching? And really, how do you think this whole ambient learning from us as experts is changing how our students are learning to be like us?
Yeah, well, it's deeply concerning. And thank you so much, Leslie, for asking that question, because I think that's such a critical question in terms of the way AI is and how that's going to transform education in the future. Are we doing a disservice to our trainees
Right.
because of this AI software? Are we not instilling this critical judgment and critical analysis and thinking and reasoning that all doctors need to succeed? And that's a problem, and this is something that we need to instill. We need to actually enhance even further in this era of AI. And this is what's going to separate an average doctor from a good doctor. It's really going to be who can sort of tap into the science of AI, but also at the same time tap into the art of medicine. And
Right.
I think
Well
that's really
said.
key. It's about understanding that a doctor isn't just about learning and memorizing facts. It's about someone who can really make decisions at the right time and use clinical judgments. And these are things that AI can't replace, right? AI is not going to be able to replace compassion. AI is not going to be able to replace empathy. AI is not going to be able to replace communication. AI is not going to be able to replace this ability to reason clinically, like making decisions. A patient comes in, for example, with chest pain, and they don't read the textbook. They're presenting very differently. What do you do? Do you discharge them? Do you do this test? Do you send them to cardiology? I mean, AI is not going to answer that question for you. It's going to be
Right.
your clinical judgment, right? I mean, the same thing in radiology. You have a scan. You have a bone lesion on a CT exam. What do you do? Are you going to recommend that they get a biopsy? Are you going to recommend that they get 6-week follow-up with another imaging modality? Do you send them home? Again, the AI is not going to answer that question for you. It's you. It's your clinical reasoning and judgment. So how do we foster an environment where we enhance clinical reasoning and judgment? And that's important, and that's key. And those are the skills that we still have to teach. Those are the skills that we still have to. Yes, it's okay to use AI to help us and to augment our practice, but that shouldn't be at the expense of clinical reasoning and judgment. And the challenge of education is being able to foster that and enhance that and to teach that going forward.
So help me reimagine that. So, you now have fourth year medical students going into radiology or incoming, radiology residents. And fairly soon, if I'd done the math recently, it's kind of scary. Fairly soon, 3 years, 4 years from now, you're going to have medical students and probably early interns who grew up
Mhm.
with AI in college, at least, Chat GPT and other things like that. So they would truly be AI native at some level in their education. So, thinking of the future for me right now, if you're
Yeah.
thinking now about those residents and those medical students, and you're somebody who's been using technology a fair amount,
Mhm.
imagine that with me. What do you think our education system needs to do over the next couple of years? They're going to be our colleagues pretty soon. How do we bring them along?
Well, we have to enhance this thought process by giving them activities to
Hmm.
exercise this thought process. So,
Hmm.
for example, even in radiology, what I'll say is that this AI tool that I was telling you about with, the impression, we don't allow residents to use that tool. And we do that.
Hmm.
We do that strategically because we want them to go through the thought process of crafting an impression, because that's an important part of being a radiologist, to be able to succinctly craft an impression on
Right.
your own so that you can communicate your results effectively to referring physicians and to your patients, obviously. And it goes beyond that. When you do readouts, so when we do readouts, or when I do readouts with my residents or medical students, using the Socratic method, asking them questions, when you go over cases, asking them, well, why would you favor this as a benign lesion versus a malignant lesion, and explain your thought process. These are questions we have to ask. We have to sort of tune into their clinical judgment, their clinical reasoning, and deciphering why they think something versus the other. These are the inherent skills that make you a competent clinician. These are the skills that AI is not going to solve. And this is what we have to focus on. This is what we have to build and sort of develop in our trainees. Case-based learning, the way we do case-based learning, interaction, asking questions, coming up with, problem-based learning, asking questions first, flip classroom. These are all ways where we're instilling this thought process that allows these students to blossom and become excellent clinicians. This is going to become even more important as we, introduce the educational pedagogy of the future, where AI is absolutely going to be part of that pedagogy. AI is going to be a bystander there, where it's going to help us. It's going to augment up. It may personalize education, but these other aspects of education have to be developed and have to be robust in order for the clinicians of the future to really be good and adequate clinicians.
So I could not agree more. And it was really interesting. I don't know if you've seen it, but I read a wonderful article yesterday morning in the New York Times Magazine by Dr. Helen Young, who's an associate professor of emergency medicine. And in it, she really writes about her experience using an AI scribe. So, as an emergency room physician, really, hers is just pulling in that information. And, yes, she admits she really enjoys the obvious benefits, and really speaks to the, how it's addressing burnout and challenges that we all face in clinical practice in and of itself. But she really reflected very poignantly on the potential downsides to diagnostic reasoning and clinical decision making, because, as she said in her article, when you are typing it yourself, you are proving it to yourself first.
Uh,
You're the one having to tell yourself that this is what's going on and kind of saying to yourself, am I, telling myself something that's true, or maybe something that I'm just trying to get through this next note? So I
yeah.
think I agree with you. I think in many of these respects, this is going to be a really interesting aspect of how we think
Yeah.
about teaching. So my question for you in this regard then is, you've been doing this for a while in radiology. You're absolutely right. You guys are leading in this regard, and you're starting to see, as you said, really some nice, benefits for you and your practice. Have you seen your colleagues turn some of that added time back into the kinds of teaching skills that you're talking about, taking the time to walk students and residents through? So tell me a little bit more about that.
Yes, yes, I absolutely have. And let me start by just saying, Leslie, there's pros and cons, right? I mean, even if you
Right.
when you consider that example of the scribe, the con is exactly like you stated. There's benefit to talking it out and writing it out yourself. You think about the different possibilities. It allows for a lot more mental clarity when you're crafting a note yourself. But there's pros too, right? I mean, if you have a scribe that's copying your encounter and makes the clinical note for you, you've saved an enormous amount of time. And physicians are burning out at
Right.
alarming rates. I mean,
Yes.
people say that 50% of physicians are saying that they're burning out because of these bureaucratic tasks. So if we eliminate those, well, then that means that these physicians have more time to talk to patients, they have more time to teach, and they have more time to just enjoy the profession that they signed up for, right? So pros and cons, definitely. So, but with that said, what I will say is that yes, I have seen definite pros to this, and it's in the time that's been saved. A time that's been saved without doing these bureaucratic tasks. Radiologists also are burning out at alarming numbers. We're asked to read way more scans every day. I read double, if not triple, what I did 6 or 7 years ago. And it's significantly more. And you're exhausted, you're fatigued. But when you have these AI tools that allow you to be more efficient, it gives you more time. And I always worry that I'm not teaching my residents enough because I have to read, so I have to clear the list, for tomorrow.
Right.
But what these AI tools do is it allows us to clear them faster, right? And be more effective. And then I do have 20 or 30 more minutes more time. And then guess what? I can do a short teaching session with my medical students or residents. I can pull up an anonymous case where I can say, hey, third and fourth year medical students, come here. Let's take a look at this case. Tell me what you think and let's discuss it. I do this now much more frequently because of AI tools that are at my disposal, right? Same thing with residents. I have more time to do one-on-one readouts with my trainees. Other faculty have told me the exact same thing. So there is no doubt that there is positivity to some of these AI tools because they're allowing us to be much more effective, much more efficient. These are the pros, in contrast to the cons that you highlighted in that New York Times article, which I think are very fair and definitely absolutely correct.
So let's talk a little bit more, then move past teaching and start talking about assessment. So, a lot of what you're talking about is, ensuring that we make sure that our students and our residents have good clinical reasoning skills, good critical thinking skills. But the way in which we do that is not just to teach them to do that, but also to assess their progress in that way. So, has there been anything about the implementation of AI into your teaching environment that's changing how you're assessing your medical students or your residents as they're moving clinically through your work with you?
Well, what I'll say is our assessment shouldn't change. And I hope that doesn't surprise anyone who's listening to this, right? So what I mean by that is that the way we assess students should really be on higher order level learning, right? So not memorization, not, if they can regurgitate facts, not if they can tell me, the steps of the Krebs cycle, or not if they can tell me what the clinical criteria is for congestive heart failure. I mean, that's not that's not real learning, right? Real learning is assessing, can they make appropriate decisions when they're given a clinical scenario, as we do in case-based learning, right? Or problem-based learning. Do they understand what the next best step is in management, right? That's the way we should be assessing our training. That shouldn't change. We should, in fact, with the advent of AI, because it is able to give us an enormous amount of information in a very fast rate, we should be really assessing students at higher order thinking levels through things like flipped classrooms, problem-based learning, interactive case teaching. Similarly, we should be assessing our students in terms of how well they're able to communicate effectively. When we do, scenarios with patients, with live patients, how well were they able to deliver bad news to a patient? How well were they able to deliver, what the treatment regimen would be for this patient with diabetes? This is how we need to assess our students, right? But that's not different than how we assessed them 10 years ago, right? But it just becomes more important and more amplified now with this era of technology, in this era of AI, where the lower level learning is just more open to our disposal. It's just more accessible for our learners going into the future.
I think most of us would not at all disagree with you. And it does elevate, I think, in many respects,
Amen.
the importance. And we hope that the time saved with our faculty educators is being used, really to lean in a bit more into a task that takes a fair amount of time. So let me actually bring those two things together. You really benefited a great deal from the use of AI in your clinical world. You talked a lot about how it's working with radiology and with reading films. What do you think about the utility of AI being applied to learning in a way that amplifies or elevates the teaching and assessment of just those skills that you're talking about?
Hey, listen, I'm all for it. If we can find ways where AI can elevate, communication skills or, clinical reasoning, that's great. It's a tool. We should use it at our disposal to enhance education. We're always trying to push the bar in education, in innovation, in the way we are able to use educational assessment tools or innovative teaching methods. That's what we do as educators. That's what Aquifer does every year. When I was coming to Wellspring, I was seeing new AI tools that were being advertised, in our breakout sessions. That's what we do as educators. So I would welcome that, and that is the future, to be able to use these to enhance those skills. But at the end of the day, you're a human being. And, at the end of the day, patients want to be heard by a person, not a machine. At the
Yeah.
end of the day, it's the human connection that makes medicine special. It's taking care of patients, not the knowledge, not the assessments, not these other things that we're talking about. And there's no replacement, for that. And I want everyone to understand that it's really a partnership. Well, what's happening, what's
Right.
evolving in the next 5 or 10 years is really this partnership between artificial intelligence and medicine and clinical care. So I welcome it. And I think we're going to find new and innovative ways as time goes on to elevate those skills that I'm talking about.
Yeah.
But it still needs to be practiced by human beings. So I think that
Absolutely.
goes without saying.
Absolutely. We're not quite ready for Dr. Claude yet, are we?
No, we're not.
So I'd love to turn our attention now to that complex environment then that that you and our colleagues are experiencing. So there is this tension right now between learning or teaching with AI, as we were just talking about, learning about AI because we're all on that same learning curve, and many who are outside of radiology are kind of just starting to come into, or maybe in the last year or so, becoming more comfortable, including ambient scribing and things like that. But then also learning how to use AI effectively, in your own clinical practice. And so it's a really interesting place where we as clinician educators have been put in order to work kind of like right out there with everybody else in trying to do all these things, but also apply it, to our own teaching and learning. So how would you say, based on your own experience, probably doing this a bit earlier, how should educators now be thinking about this tension in motion, as I call it, in which they're kind of trying to have to figure it out all for themselves, while at the same time their learners are coming up very swiftly in their own
Yeah.
skills?
Yeah, I would say it's a problem and it's a tension. And there's no doubt about that. And we're all in this together. It's very unique because it's a situation where the teacher and the student are both experiencing this at the same time. And we're also learning about it, evolving with it, and trying to explain it at the exact same time. And it's also very unique because it's at a time where perhaps the student may be more experienced in using it compared to the clinician or the master educator, so to speak, right? So it's very interesting. I don't think we've ever seen anything like this in the history of education,
Never.
where the student may have even more experience than the teacher, or they may be more familiar, maybe familiar is a better word, familiar with it compared to the teacher. So it's a situation where we're in unprecedented waters. We're all evolving with it. We're all learning at the same time. So it requires a level of humility. It requires us to be patient. It requires us to, learn together. There's nothing wrong with learning about this together, understanding it together, and having it evolve together with time. And I think one of the major challenges is to figure out, how do we take this? How do we teach this? And how, we talk about building AI into the curriculum and studying data sets and doing these type of things, but no one has really come up with, how are we going to evaluate AI in our curriculum, or
Right.
how are we going to teach evaluating critically AI algorithms? We talk about it, but no one's done it. You know what I mean? So I think that's a major problem, and that's something that we have to figure out as educators. We have to figure out in terms of how we sew that into educational pedagogy in undergraduate and graduate medical education, quite frankly.
Well, it's interesting as you're talking, it's bringing me back to something I've thought about, in the past is having maybe a few more years on you in clinical practice. One of the things that really rolled out early in my training was the whole idea of evidence-based medicine. And it was yet another, I was probably the precursor for me not nearly quite so dramatic, of the faculty learning the tenets of evidence-based medicine as we as students were truly learning it in the curriculum, and sometimes we're further ahead than our faculty in doing that. But one of the things that was also interesting, and I think is still relevant, is that was really the first time I think we had a structured formal curriculum on how to critically appraise something, how to critically appraise, standard traditional research outputs, ask good questions, take a look at the evidence, decide if it applies, figure out what to do with it, the good old fashioned PICO question. And
Mhm.
so to me, it almost makes me think the fact that some of those evidence-based medicine skills that may or may not, be the things that we've doubled down on recently really are becoming much more important now as
Yes.
well. So what are your thoughts about sort of resurrecting a curriculum and thinking that way?
I couldn't agree more, and well said, Leslie. I think those exact skills that you literally just articulated is precisely what we need in this era of AI. Because being able to critically evaluate data sets, looking at data sets that train our machine learning algorithms for AI. This data literacy is what needs to be taught, to this future generation. Being able to look at data sets and figure out, well, what are the biases here? How is this going to affect an AI output, and how is that going to affect my clinical care in the way I interact with patients? This data literacy, this clinical reasoning are the skills and the tools that are necessary for the future quintessential clinician to be
Mhm,
successful.
mhm.
Exactly like you're talking about with the evidence based thinking and the framework.
Right.
This is what needs to be resurrected, and this is exactly what the future is going to unhold for future clinicians.
Well, and the other piece that's really, again, having come back from IMC and spent a lot of time with my basic science colleagues, is kind of a passion of mine, is, one of the most important things, we talk about in medicine is being good clinical reasoners and good clinical diagnosticians. What our science colleagues talk about, and so for us, like the summary statement and being able to, in a very pithy way, articulate what's going on with our patient. Our basic science colleagues often talk about, especially as a PhD in their development as a PhD, the critical importance of asking a good question or
Mm.
asking the right question, knowing what questions to ask, and testing really good hypotheses. What do you think our students might be able to bring over from their basic science years in terms of, or even their science professors, and apply into how they might now need to be using AI in their clinical years that may not be quite so apparent to them right now?
I think that's a great point. I think that's a skill that's going to be critically important and it's going to evolve. And I think our students are already picking up that skill.
Huh, interesting.
What I mean by that is that because they're using, I guarantee you, if you were to poll your students and you ask them, how many of you are using ChatGPT currently? I would imagine at least 95% of them would say yes, right?
Yeah,
And then,
yeah.
so it comes back to what you just said about asking the right question. So,
Mhm.
the more and more you use these AI tools, the better you get at asking it the right question, right? So,
Right.
as you hone in, you may ask it, a question on a clinical scenario, but then you start honing in on, asking it a better question so that it gives you a more detailed answer. Then you ask a follow-up question that kind of gets into exactly what you're looking for. It's this ability to ask the right question that's going to allow you to arrive at a greater truth or something that is going to be more meaningful for your clinical experience or your educational experience. So this is a skill that I'm finding we are starting to learn better, but I find that our students may have it down better than we do. You know what I mean? And
That's a
I think
really, yeah.
which I think is remarkable, and
Yeah.
it's really a testament to humility too. I think that we need to understand and we need to work with them. I mean, this is also a partnership
Mhm.
with
Right.
students. We can also learn from them in terms of how to best navigate this new AI world. And I think in a lot of ways, there's a lot for us to learn from them.
Absolutely, absolutely. And to follow up on what you just said, my team knows I like Mr. Claude. Claude's sort of my, there's no money coming in from Claude for me, but I just, somehow he and I have the right personality mix. But what's I found very early on in using AI tools is I really began to appreciate being a good prompt writer. And this is where some of my thinking came up too. Is like I need to make sure if I ask kind of not the world's best question, I'm going to kind of get the answer that you're like, that's not what I was looking for. And as I was doing that, I was beginning to think about getting back to this idea of asking good questions, and maybe that's part of the skill that our students are learning is they're actually
Yeah.
getting better at asking good questions that maybe we weren't really good at teaching them how to do that in the past. Are you seeing that? And also, is there anything else that's kind of surfacing for you and surprising you about what our students are bringing to the table now that we hadn't expected?
Well, what I would say, Leslie, is that what's surprising me is how well versed they all are in a
Mhm.
lot of these tools. I'm amazed at how much our trainees know. I'm amazed at how much they're using it regularly for everything. I mean, from preparation for teaching rounds to crafting emails. I mean, I don't use it to write emails, but I mean they do, and I can tell that they, when I receive an email, I'm like, this is for sure, so they put this in chat GPT and they, crafted this email and they send it to me, right? So I mean, it doesn't take a genius to figure that out, but they're really using it in a lot of different ways. So I think it amazes me, just the use of it and how pervasive it is and how widespread it has now become amongst our trainees. That is really what surprised me, in terms of the way it's being used, the way it has really transformed everything from the way people think, the way people are using it, and future endeavors and future looks as to where it may go. So that's been the most eye-opening thing for me.
Yeah, I don't disagree. And I think in many respects, it just continues to be something as these new tools roll out more and more. You just have to continue to elevate your next level of skills and how you're thinking about it. So let's think about, maybe some people who are just coming in to learning about, or maybe a little overwhelmed with this, flood of AI tools, particularly as it finds its way into all the other disciplines of medicine. Leveraging your experience over the last couple of years, are there like two or three just pragmatic things? If you were going to a medical educators conference now of people who are like relative novices and they were looking at you and you were maybe just giving them a plenary and talking about like, here are the most like three things that you really could just do tomorrow based on my experience or not do, what would be a couple of those pragmatic things you would recommend to them?
Well, I would start just by saying that, first of all, experiment. First of all, just, there are so many different tools. There's ChatGPT, there's Claude, there's, in radiology, we have different tools. There's AI scribe, tools that
Yeah.
record encounters. Just try them. I think there's nothing wrong with, just experimenting. I think that's how we learn, right? And we're all learning together. And this is not a race, right? It's a marathon, right? And we're in this together where we're going to learn slowly. So I would say, be patient, experiment, and ask questions and keep trying. I think the more you use it, the better you get at it. It's kind of like asking the right question, right? Which we kind of just alluded to, just being able to, you know, evolve with it, evolve with it, right? It's not going anywhere. If anything, we're going to start to see more and more AI applications down the road. Pick one or two, try to see how it can benefit you. You may be surprised. I have so many colleagues that are hesitant to use AI, right? I
Really?
mean, yeah, I mean, I would say that our students aren't, but our colleagues are, and a lot of them don't want to, because
Be
we're always
afraid.
resistant to. Exactly. I mean, listen, I think most people are resistant to change, especially people, master educators that have done things in a
Yeah.
certain way, or,
Yeah.
and it's worked for them. Now there's a new tool on the block. Why use it when what I'm doing is already working well, right? But what I would say is give it a try. Be open-minded enough to try things. You'd be surprised at how much you may like it or how well maybe it may transform something for you. You can even use it to craft questions for you. You know what I mean? There's just so many applications that you could do. So what I would say is just be patient and try it and give it a shot and evolve with it. Take your time. There's nothing. There's no rush. It's not going anywhere. It's going to be
Right.
here for a long time. Uh, Give it a shot. Why not?
A couple of follow-up questions to that then. One, do you have a really good story about maybe how you've worked with a colleague of yours who was reticent and maybe was kind of flailing or having a fail here and there, and you were really able to get them kind of from where they were to where they are next, and maybe some of the things you helped them with, they got them to a place where they began to feel comfortable?
What I'll say is, if we come back to this example of this impression, this idea of AI crafting an impression, I can remember just I think we introduced this tool 6 months
Mhm.
ago. So it's a
Oh,
fairly new
really?
AI tool.
Wow.
Oh yeah, yeah. It's a fairly new AI tool that we started here in radiology. But I remember vividly, when it was first introduced. I was talking to my colleague in the reading room, and they were very skeptical about it. They're like, "Oh, I'm definitely not going to use this.
Yeah.
It's going to mess up every time, and I'm not trusting a machine to do this. But yada yada yada." But then honestly, I'm using it and I love it. I told them that I was like, it's able to use my own language. I have to correct it very minimally. There are times I make subtle tweaks, but overall, it's very good. It's been saving me a lot of time, and I think when I said that, they were, I think it was eye opening for them, and they started trying it, and I think they enjoy it now, right? So
Yeah.
I think part of it is just getting over the hunch of being resistant to change. And I think, just accepting and being willing and open minded to try something different, because you never know what the outcome will be. And I think I call that's a success story, right? Because that allowed that person to use something that is benefiting him or her, in a way that, whether it's time save, a better report, articulating an idea more clearly, whatever it may be, it's of benefit. So why not do it?
And here you told me you were not a thought leader. All right. I don't know
Uh,
if I believe
uh,
that anymore. But
I don't know. I don't. Not to your level, Leslie.
oh no.
I'm an amateur compared to you.
But let's talk a little bit more about that though too. Is I think in many respects, obviously one of the biggest issues with AI and using it clinically and in teaching and learning is trust. Is this idea of trust? And I think sometimes things are moving so fast that our colleagues, especially who aren't as digitally comfortable, really some of the trust issues are there. And then, like our patients, look to us as humans that they trust to help them better find a bridge to trusting, the technology, whether it's AI or any other technology tool. So, what have you found for yourself? Like you said, you even went into it skeptically. You're like, I'm not so sure about this thing. And you quickly, found your way to, hey, this is great. I trust it. I'm going to use it because it's in your clinical care and it's your name. It's going with it as well. What were some of the things going through your own head as you were looking at that tool and you were making your own internal tacit decisions about, do I like this or don't I like this? Kind of open up your thinking a bit, to the audience. And what were some of the thoughts that you had, and what may have made you go like, yeah, not ready yet versus, yeah, I think I can use this.
Well, what I'll say is that uh, it's important to evaluate it critically, right? All AI tools should be evaluated very critically, and that's up to us. That's up to us to do. And ultimately, the physician is the ultimate arbiter for medical information, medical knowledge, medical decision making. It's not your phone or or an AI tool. That's not how it works, right? So you always have to go in with a skeptical eye. You always have to have your critical thinking cap on when you're evaluating these, because you don't, it's not always perfect. As we've stated before, there are errors, there's fabrication, which is a real risk.
Mhm.
So I'm always thinking in that light.
Mhm.
When I'm using
Mhm.
these tools, I'm always critically evaluating, is this right? Is this what I would have done anyways without the tool? Is it making a mistake, or will it do harm? These are all questions that I hope everyone asks when they're using these tools. And these are also things that you want to role model to your trainees as they use these tools. So I think that's very critically important to convey. And to your point about patients too, these patients are also using these same exact tools.
Right.
They come to us with a bunch of questions after having already researched it. I mean, this is also something that we've never seen before, with patients coming in with an enormous amount of information about a certain disease. They've researched it heavily. They have their own opinions about things, and they're willing. They want to see where you stand on many of these things, and they want to see how well you know it, etc. Too. So I think it's very important to convey to them and to be the ultimate expert, and to be able to instill that confidence and trust in them by letting them know that yes, these are good tools and they're important, and it's a great service in terms of communicating, but ultimately it's your expertise that makes you the physician, right? It's your expertise that makes you an indispensable part of the healthcare team that machine wasn't able to convey, right? So I think it's two sides of the coin.
Yeah. No, absolutely. It's kind of feeling like we did practice a little bit of this with, WebMD and Dr. Google, and now it's just exponentially taken off as
Oh yeah.
well. So let's kind of close up and kind of look ahead, start to reimagine the next 5 to 7 years, which, in the past to us in medicine and medical education often felt like, oh, yeah, I can see out 5 to 7 years. Now no one can see out 5 to 7 years. But, it's our job today to think about it a little bit more. So I've got two questions for you. And the first one is, so you as a radiologist, as you're reading films, your knowledge of anatomy has got to be really good. You've got to be able to
Mhm.
understand what anatomy is like, what you can see in the various radiologic tools, how it fits in the body, the 3D structures, all those things, plus your physiology and all those other things as well. What might be your idea of what the future of clinical learning needs to be when the basic sciences are very well known by our AI chatbot friends?
Yeah.
How might we have to think about science education differently as our students are moving into a world in which the chatbots that they are working with
Yeah.
already know far more science than they do?
Yeah, well, I think what you're going to see, Leslie, in the next 5 to 7 years is a lot of personalized education, and AI is going to help, augment this type of personalized education. What I mean by that is that you'll see a lot of students mastering, anatomy, physiology, and these, preclinical topics, but in a way where AI will help them achieve that mastery and, giving them the opportunity, giving them tests and assessments where, they're able to look at these things. And let's say they're weak in, a brachial plexus, then, AI tools will allow them, give them exercises where they'll be able to strengthen those skills, in
Mhm.
real time by giving them more questions or giving them graded level of difficulty questions where based on their strengths and their weaknesses. I think that's what we're going to. So we're going to start to see this personalized level of
Mhm.
education
Mhm.
become much more elevated and taken to levels that we haven't seen before, which I
Yeah.
think overall is a good thing, right? I mean, it's gonna allow people to achieve competencies at different levels, but in a very personal way with the help of AI. I think that's what we're really going to see. And I think what we're also going to see, Leslie, is a lot more emphasis on evaluating AI, finding ways, although that hasn't been figured out, as we talked about
Mm.
earlier,
Mhm.
using, data driven metrics to, critically evaluate AI. How do we implement that in curriculum? How are we able
Oh,
to,
yeah.
teach people how to evaluate data sets so that whether or not they have bias in them or not? That's a new thing that hasn't been taught in medical school pedagogy, but will probably be present in 7 or 8 or 9 years.
Yeah. It sounds like a future podcast for you and me with your background in informatics as well as thinking about what the curriculum in AI needs to
Let's
be for
do
our
it. Let's
students
let's do it, Leslie.
going
And
forward.
I think s- Aquifer should do this. Aquifer should be the one that makes this curriculum because you guys have been so innovative. You guys have been the ones at the forefront of with case-based learning, interactive teaching. This is a space that no one has tapped into,
Yeah.
and this could really be huge.
Well, thank you. Maybe we won't have a podcast for a while because I have to go do that now as well. And, interestingly, one of my original visions too, though, was can we do things with technology that will help bring our physician educators back to the bedside, to use the old fashioned term, with our learners and do exactly what you're talking about? What do you think? Talking a lot about burnout now and talking
Mhm.
about, is this helping our physician burnout
Yeah.
issue? Do you think our colleagues will then find this truly a reason to turn back around to their learners and really pick back up the mantle of in-person learning with them?
I think it's hard to say, Leslie, but what I will say is that I think it does have the potential to do that because of some of the reasons what I stated earlier, because it does relieve a lot of the burnout. It does relieve a lot of the bureaucratic tasks. It does, give you some time back into your day so that if you choose to, you can teach. You can teach more at the bedside. You can spend 15 extra minutes at the bedside talking about a physical exam assessment or how to interview a patient or, how in radiology to go over, the anatomy on a scan. That time is given to you in a way that perhaps you find joy. I find more joy in teaching residents versus reading 50 MRIs in one day. I
Oh,
would
come
think
on.
that a cardiologist finds more joy, teaching their, fellows than, having to dictate 30 reports in one day, right? I mean, you see what I'm saying. So I think
Yeah.
that, you know, it has that potential to do that. And it definitely has a potential to, mitigate burnout in a way that could be beneficial to people.
Yeah, well, let's hope. Let's hope. I think you and I are
Yeah,
both
yeah.
trying to drive to the same thing as
That's perfect.
well. So, I'm going to give you the last question, to sort of help us think about the future together as well is Given all the work that you've done so far, what do you think are the hard questions that we're still not asking, or at least not answering honestly, about what the world's going to look like in medical education in the next 5 to 7 years?
Well, one is we somewhat talked about is what is this curriculum really going to look like? Everyone
Yeah.
talks about, oh, AI is going to be part of, we're going to train our students or residents in AI and AI, fluency. What does that mean exactly?
What does
No
that
one
mean?
has really articulated exactly what that means. Does that mean they're going to get lectures in AI? Does that mean that they're going to critically evaluate data sets? Does that mean that they are going to have dedicated time to really understand what a convoluted neural network looks like? What does that mean? I think that there's a lot of ambiguity to that, quite frankly. So I think that needs to be figured out. I think there's always this fear that AI is going to replace us. I've been hearing this for decades, as a radiologist, especially me, everyone
Yeah.
on radiology, because it's so technologically savvy, right? So we hear this all the time, that people are we've had physicians that go on CNN saying that AI is going to replace radiologists, and this is it's a common threat. But what I can tell you is that there's never been more of a demand for radiologists. And there's such a shortage now that we're being asked to do more and more and more and more. So I think it's ironic that we get these debates. So that's something that's always in the back of people's mind. That's something certainly in the back of trainees' minds as they decide to pursue a career
Right.
in medicine. I think that is also why you've seen less people applying to become a doctor now, which I think is sad, but it's a reality. So I think these are some of the questions that we have to face. We have to face them honestly,
Mhm.
and hopefully we'll get good solutions. As with thought leaders like yourself, Leslie, as time goes on.
Well, thank you. That's a very kind thing to say. But I think it's a lot of why we really have kicked off this podcast about reimagining, because I think there's a lot to reimagine. And you and I are both optimists, but we're also pragmatists. And I think it's really realists, people like us who will both be a little bold and fierce for everybody else, but then also really bringing home the pragmatic solutions and digging into the hard ways in which we're going to need to do it. So, Omer, with that, I think it's a wrap. I just really want to thank you so much for being here with me today. It's just been such a pleasure to get a chance to see and talk with you again recently. And I know you've given me a lot of things to think about and a few things to do, apparently. And I know everybody else listening here will believe the same thing. So thank you once again.
Oh, thank you so much, Leslie. So fun to do this with you.
Thank you for listening today. I hope we've left you inspired. For more on how Aquifer is moving health professions education forward, visit us at aquifer.org/clinical-learning-reimagined. Onwards and upwards.